Improve your competence as an REBT therapist. Match client's level of specificity of beliefs. As a rational emotive behavior (RBT) therapist, you know that very early in therapy you are to gather the ABCs, that is, the critical activating event, the relevant dysfunctional emotions and behaviors, and the contributing inferences and beliefs. Identifying the critical activating event is rarely problematical, but it is important to focus on relevant details of the part or parts of the event or situation that are most relevant to the dysfunctional emotions and behaviors. It is often best to ask the client for the most recent event in which the dysfunctional emotions and behaviors occurred and inquire what part of that event was the client most disturbed about and most relevant to the dysfunctional emotions and behaviors. Identifying the emotions involves identifying and assessing the emotions as identified by the client. While RBT has an ideal vocabulary of emotions, it is important to use the client's word or words for the emotions. For whatever words the client uses for the emotions, it is the duty of the therapist to assess the functionality of the emotions. It is vital not to react to the word and assume that because within the RBT ideal vocabulary for emotions the emotion identified by the client is labeled as functional or dysfunctional, that the therapist assumes the functionality or dysfunctionality of the emotion. In RBT we do not react to the word for the emotion, but the reality of the emotion. This necessitates that the therapist assesses the functionality or dysfunctionality of the client's labeled emotion. How? Explore whether the emotion supports or impedes the client from attaining desired goals within the relevant domain of life. If it supports the goal attainment, it is functional. If it impedes the attainment, it is dysfunctional. It is not the intensity of the emotion that determines functionality or dysfunctionality, but the relationship of the emotion to the client's goal attainment. Finally, one common error I see with therapists when identifying dysfunctional beliefs is that if a client identifies a belief within a specific situation, that is the critical activating event, the therapist often disputes a belief that is more general. For example, just yesterday I was working with a supervisee who had a client who identified having anxiety about having to tell a boss, who he liked very much, that he was going to retire. One of the client's dysfunctional beliefs was that it would be awful being in the presence of the boss, look at him, and tell him that he was going to retire in a few months. The supervisee disputed the belief. It would be awful telling someone that you liked that you were going to retire. Notice that the client's belief was relevant to a specific situation involving a specific individual. The client did not say that he thought it would be awful to tell just anyone that he was going to retire, only to tell that one specific individual. It is important when disputing a client's irrational or unhelpful beliefs that the level of specificity or generality of the dispute matches the level of specificity or generality of the client's dysfunctional beliefs. Once that task has been accomplished, and the client has replaced the dysfunctional belief with a more adaptive belief, then the therapist can not only check the presence of the dysfunctional belief in the client's other domains of life, but also the generality or scope of the dysfunctional beliefs and sequentially and completely dispute those beliefs. I hope you found this short video helpful. Please consider subscribing to the REBT Education and Training YouTube channel.